Let's get started then. Shall we get started? Welcome to everyone who's joined us for this short but very interesting webinar from the Institute of Health Equity at University College London. We started in 2011, following on from the report that we published in 2010 for Society Healthy Lives, an examination of health inequalities in England, which was followed up by a 10 years on report in 2020. We do work in the UK, but we also work internationally, and Michael Marmot is started the Institute of Health Equity, and based on his long career of work on the social determinants of health and health inequalities and trying to get the world to listen. Well, today the world has been listening to the report that we've published today, Fuel Poverty, Cold Homes and Health Inequalities in the UK. And Michael has managed to squeeze in an appearance for us this afternoon in between the many media appearances he's doing. Michael, if you could welcome us or have a few words, please.
I'm delighted to welcome you and welcome the interest. You know, the conventional wisdom is if 50% of the people who sign up attend, you're doing well. I think we must have close to 100% of the people who signed up are here. So it shows the level of interest. Let me make 2 or 3 comments. One question that I was asked today on one of the news programs, the item before mine was about the floods in Pakistan, which are disastrous. And the interviewer asked me, in a way she put it in the context, our report in the context of the floods in Pakistan. She said, you know, that's less developed, middle income or low to middle income country. What's going on in Britain? And I said, yeah, you would not imagine in the 5th richest country in the world that more than 60% of people would be facing fuel poverty this winter. It's astonishing. And it is unnecessary. It need not have happened. The second question that I was asked by a different interviewer, at the end she said, is this the most important report you've done? And I had to pause and think about that one. She won't use my answer, of course, because I was thoughtful and there's no place for thoughtfulness on television news. But I then said, no, I would say the WHO Commission on Social Determinants of Health, because that set the agenda. It was 2008, and it was because of the WHO Commission report that I was invited to do, by Gordon Brown, to do what became the Marmot Review, Fair Society, Healthy Lives, and many other countries have taken this on. I would say the importance of the report we published today is it summarizes many of the important issues that we've been worrying away at, talking about, summarizing, urging governments to take seriously. Because, as we said in the report, fuel poverty means being cold and being poor. I said at the end of the press conference, which you chaired, Tammy, again, I got a bit philosophical, which none of the media picked up, but I said people talk about Maslow's hierarchy of needs. You know, you need to get the basic needs in place, then you can worry about security and well-being and so on. And I said, no, what our report shows is they go together. The worry about how you get the basic needs together, faced with fuel poverty, is in itself a determinant of health. That stress of being unable to make ends meet shrinks your life so you can think about little else but being cold and being hungry and being poor. And to emphasize, this need not have happened. Others will take this up. But if you think of the 3 components of fuel poverty, poverty, price of fuel, and energy efficiency of housing all could have been dealt with by government action before now, quite apart from the urgent action that's needed right now. I'm sure people are encouraged that the would-be prime ministers are talking about how to create greater health and well-being for the population. We can be optimistic about the future. They've stopped talking about, I'm being ironic, talking about tax cuts is insufficient to the task that's at hand. We need to put equity of health and well-being at the heart of all government policy. And nothing shows that more clearly than this current report on fuel poverty, cold homes, and health inequalities. Thanks, Tammy.
Thanks, Michael. And that word astonishing and unnecessary, I think, will come across in today's talk. Certainly, I'm Canadian and I had to be educated on the issue of fuel poverty, even though I come from a land where we have snow for many months of the year, but we do not, on the whole, have much fuel poverty. But in a country like the UK, this is a massive problem and will become even more so. Just a little bit of housekeeping. I apologize. We don't hold many webinars ourselves, so we're getting through all of the names and hopefully those beeps will go away soon for everyone. This is being recorded, so it will be available afterwards. If you have questions, if we could try and keep the chat to the questions, that would be fantastic. And they are being monitored and we'll have some time at the end of the presentations. And the first presentation we have is Jessica Allen, Dr. Jessica Allen, who's the Deputy Director of the Institute for Health Equity, who is going to talk about the report that's been published today and is available on our website. Jessica.
Thank you, Tammy. Nice to see, great to see so many people here. Sorry about the beeping, as Tammy said. I'll just present the key findings from the report and some of the messages before we go on to discuss with colleagues Ian and Alice some of the things that are happening within Alderhay and local programmes to mitigate the effects of coal poverty. We've been working on this, as Tammy said, since the original Marmot review, and we released a report in 2011. The effects of cold homes on health are significantly and most dramatically to increase rates of mortality, death increases with living in a cold home. There are other direct health effects, including increasing respiratory conditions. Children in cold homes are twice as likely to experience respiratory conditions as those in warmer homes, increasing cardiovascular disease, really significant impacts and negative impacts on mental health, increases in dementia, hypothermia, a loss of dexterity resulting in falls, and many others, infectious diseases, increase, immunity wanes, and the list could go on, in fact. Indirect health impacts also, increases in stress, the stress of having to pay your bills, to find the money, to use that money that you might have spent on other things such as transport, food, school materials and so on. Really significant impacts on stress. Loneliness itself a very significant killer, unfortunately, and loneliness goes up when people are in fuel poverty and living in cold homes. They don't want to welcome people into their homes and socialise, invite the family around because of those conditions. Mental health impacts I've mentioned, but 1 in 4 adolescents, 25%, this is pre this current crisis, have multiple mental health problems compared to 1 in 20 adolescents who live in warm housing. Childhood development, Ian will talk about that in more detail. Significant increases in family conflict, you can imagine. Rise in household fires, the fire brigade was very exercised about this, people huddling around fires with a blanket, falling asleep. You can imagine the impacts on fires. Educational attainment goes down. I've mentioned the lack of money for other essentials, and significant other impacts that we see from families living in cold homes, possibly including a rise in adverse childhood experiences, child abuse, domestic violence, as well as stress really bites. How significant is the problem? Well, it's very significant, and this isn't new. It's been a significant problem always in the UK. We previously estimated in 2011 that nearly a fifth of the excess winter deaths that we see every year during winter months, those higher mortality rates during the winter, a fifth of them come from living in a cold home. Other estimates suggest 10% of excess winter deaths are directly from fuel poverty. Now, there's a difference between that 21.5% and the 10% because the fuel poverty definition is quite narrow, and many people who live in cold homes are excluded from being technically in fuel poverty. We prefer to go with the 21.5% of excess winter deaths from living in a cold home. In the UK, typically, excess winter deaths are around 20 to 50,000 a year. That's an increase in the number of people who die during winter months compared with spring, summer, autumn months. Last year, this is related to COVID, we had extremely high excess winter deaths of 63,000, and some of those will be related to cold homes, but many to COVID. You can see here typically in England and Wales, 20 to 50,000 people. So cold homes responsible for about a fifth of those, 4,000 in a good year. In a cold year or when poverty is particularly high, we're looking at around 10,000 people dying in the fifth richest country in the world from fuel poverty and living in cold homes. Really extraordinary high numbers. And now we move on to what may happen this winter. And again, we can't be precise about these estimates. They are estimates. There may be new interventions from the government being announced. It may be a mild winter, let's hope so. But the latest estimate from York University is that 2/3 of households in the UK will be in fuel poverty through this winter, 18 million households. So if you imagine those figures I've just relayed, up to 360,000 people dying because they are in a cold home this winter. Now, these are very bold estimates, but you can see the terrifying impacts, and this is why Michael was talking about this being a humanitarian crisis this winter. The impacts on households, on all those other health impacts I've mentioned, leads to increasing demand, significantly increasing demand to the NHS. And again, Ian will talk about what his experience is in Alderhay as a paediatric respiratory consultant. 2019, before the current crises, multiple crises, of course, the NHS spends at least £2.5 billion a year on treating illnesses that are directly linked to cold, damp and dangerous homes. £2.5 billion. Well, that could be better spent in preventing the problem in the first place, of course. Drivers of fuel poverty, no surprise. I don't imagine to any of you, household income, the cost of energy and the energy efficiency of home. We know that people, there's increasing rates of poverty, wages have stagnated. Our report Build Back Fairer, which we published in 2020, assessed what had happened over the decade 2010 to 2020, and we found some groups experiencing much higher rates of poverty, wages hadn't grown, certainly not kept up with the pace of inflation. And you can see here children and living in poverty had increased at 2014 up to 2020, a slight dip as a result of some of the programmes in the pandemic to support them. But housing costs are a major driver of child poverty and very high rates, a third of children living in poverty. So household income, a significant concern, even pre-pandemic, pre this crisis. Gas prices, well, we know what's happened there. Absolutely terrifying increases in gas prices. And there's been some discussion, Michael's entered into this discussion about the energy market and the way that the prices are traded on the international commodities market. It may well be that there's a lot of room for manoeuvre in that. Most of our gas in the UK doesn't come from Russia, isn't affected so much by the Ukrainian crisis. It's the price that's been affected, and we're linked in internationally. Can we separate off from some of that international market? Programmes to reduce cold homes. So national programmes over the last 10 years, since about 2012, 2013, there were some very good programmes around insulation to reduce fuel poverty, insulate homes, reduce greenhouse gas emission. Those have stalled, almost been completely cut in many cases. And we've seen these dramatic cuts to local government, which have had a significant impact on programmes which were in place to improve the quality of housing and to support people who are facing fuel poverty. You can see here estimates about the installations to improve household energy efficient dropped by approximately 90% since 2012. Enormous cuts. Insulation is hugely significant. I've just put this up here. There's a lot of data on this slide. I won't go into it. This CSBM, coefficient of seasonal variation mortality, it's low here in Finland. This is the increased number of people dying in the winter. Low in Finland, obviously a very cold country, relatively high in Portugal. You can see the UK also down there. And if you look at the insulation rates in Finland, 100%, and these different types of insulation compared to a very warm country, well, relatively warm country, Portugal, which has incredibly poor insulation. Likewise, the UK. And that's why we have higher seasonal variations in mortality, excess winter deaths in the UK. A graph showing the enormous drop-off in the reductions in energy efficiency of homes over the years since 2012. I've mentioned about us not receiving most of our gas supply from Russia, but the UK households were worst hit in Europe by the crisis in prices. And this shows council spending per person over the last decade. Enormous cuts. This is about the most deprived 20% of areas on the left-hand side and the least deprived on the right-hand side. And you can see most deprived areas receive significantly greater cuts in funding over this period. Enormous. The cuts were very, very stringent to public services nationally, to benefits and to local government funding. And as I've mentioned, this will have had an enormous impact on programmes to support people in fuel poverty. And the most deprived areas had the highest cuts. Who is most affected by fuel poverty? Well, there's a regional variation in rates of fuel poverty. The dark area is the highest. You can see the northwest, the northeast coastal areas in the UK, some areas in London. Waltham Forest, where we're working, has very high rates of fuel poverty. So some regional variation, but also this is very closely related to deprivation. Some ethnic differences in who's most affected. You can see ethnic minority houses much higher. We expect those rates to shoot up now past 2020, but likely to be much higher for minority ethnic houses in the UK. I just picked this up today from the IMF. The UK has the biggest gap between richest and poorest in energy costs as a proportion of income compared to these other countries in Europe. So the richest 10% in the UK spend 6% of their income on energy. The poorest 10% spend nearly 18%. And you can see the difference in the UK is the highest compared to these other countries in Europe. People living in older, less well insulated homes with lower energy band ratings below C are most likely to be affected. And this is why some people living in large houses who appear relatively wealthy will be in fuel poverty this year because of the lack of insulation in their homes. And people in poor health, I've just put this slide up here. It shows life expectancy in England. This is pre-pandemic. Sorry, this is the start of the pandemic, but you can see how life expectancy was already flattening in the UK. And in our Build Back Fair report, we reported that health had deteriorated significantly in the UK between 2010 and 2020. And you can see the impact of the pandemic in 2020. But even so, before that, flattening. Health inequalities widened. Poorer communities, those up in the north and northwest and northeast, much worse health outcomes. And life expectancy actually falling for the poorest men and women in those areas. So some really significant harm to health, and those are the people who are most likely now to be affected negatively from the health impacts of living in cold homes. Actions, plenty of national actions which can be taken, not so far, but can be. Energy pricing, I've mentioned income support, the price cap, insulation, improvements to housing quality, managing inflation, local government financing, ring-fence funding, community support for the community and voluntary sector, who do so much to support people in fuel poverty. Local authorities, public services, a whole range of things that are being done, but it's very difficult to find the funding for this, very difficult to support. The report that we published does highlight many of these areas where there is positive impact, and we know that the impact is enormously positive and can reduce those terrible health impacts. You'll have heard already that there has been a lot of press interest in our report today, which is great. They don't always pick up on the reports that we produce, even the previous reports on fuel poverty. There is a push behind now. We can really, we think, try and influence policy and get support in where it's most needed and try to reduce the worst impacts that we are likely to see this winter. So all of you in all your roles, please think about how you can have impact, how you can lobby the people that you have influence with, how you can support the people in the programmes, work with us on this. I think we all need a really strong push now. Thank you very much.
Thanks, Jessica. And as we said, we've put the link in the chat there. And I think we've had a couple of comments in the chat as well about different reports that have come out. And certainly the evidence is there. There are numerous different organisations, from the Resolution Foundation to Joseph Rowntree to ourselves, all people waiting for action and waiting for something to happen. And in the meantime, there's people like our next speaker, Professor Ian Sinha, who's the consultant respiratory paediatrician at Alderhay Children's Hospital in Liverpool. And we met Ian, and he did some work for us. Some of you may have seen in the media previously when we launched our Cheshire and Merseyside report in May of this year. And Ian has worked with his colleague Alice Lee, who will speak after Ian, and we'll have a chat. But Ian, if you could talk to us about some of the work that you've been doing at Alderhay and your thoughts on this issue of fuel poverty and cold homes. Ian, over to you.
Thank you, Tammy, and thank you everybody for joining us today. It really is an important topic, and clearly you all think so too. Like Sir Michael, I've been doing media stuff this morning, and I've been reflecting on something which occurred to me a couple of hours ago, which is that there's a change in the air. And what I mean by that, as a paediatrician, as somebody whose job is looking after children with breathing difficulties, is that I think up until now, whenever we think of cold homes, we very rightly picture elderly people and the problems they will get. And we think about, elderly people with potentially respiratory problems picking up infections in cold homes and becoming unwell, and this contributing to the excess mortality. But what I'm sensing this year is that we are equally and rightly concerned about the impact of this crisis, this potentially humanitarian crisis, on the generation of children who live in the UK. I won't talk for long because I would like to pass over to Alice, and we're very proud of Dr. Alice Lee and the work she's been doing. And we're very grateful to Sir Michael and his team for being so welcoming and such excellent mentors for both her and me. I wanted to just raise a couple of points, and these are the kinds of points that we think about in children, whether it's fuel poverty, food poverty, mattress poverty, stationary poverty, whatever the poverty is, it's a manifestation of poverty, and children always lose out. There are some specific issues when we think about this current fuel poverty crisis. One of the scariest pictures in respiratory paediatrics is the graph that we show when we talk about what your lungs do over the life course. And in essence, there is a window of opportunity. In childhood, your lungs grow quickly, particularly in the early years, and you hit adulthood and things start to decline, like they do in many bodily systems. Nothing works better in me at 43 than it did when I was 21. Your lungs, like your body, declines. So how you enter adulthood, is absolutely crucial. And when we think about the respiratory excess mortality, a lot of those people will have chronic respiratory adult diseases, things like COPD, bronchitis and emphysema. But now we know from the long-term follow-up of studies in the 50s and 60s, we see that in over half the people who have COPD, you can trace it back to childhood, to the early years to the circumstances and the situations in which we are forcing children to live. So the impact on children this year will be twofold, well, threefold. And I just wanted to highlight those here. Firstly, we will see that there are children who get or have an increased risk of common viral respiratory infections and bacterial infections like pneumonia. We will find children who are predisposed to this because of the house in which they live. And these things don't happen in isolation. Those will be the very children who are utilising food banks, the very children living on main roads, the very children who are surrounded by the manifestations of poverty. So that's one thing that we are worried about. And as we said in our press conference yesterday, and as I've said to the media today, and as others have also said, I'm in no doubt that a child somewhere in the UK will die as an either direct or closely indirect response to the house being cold and the quality of their housing. And we're already seeing that pattern happening. And this is something that has been highlighted in the National Child Mortality Database, an excellent resource if you haven't come across it. It's something that's so important to us as paediatricians, because they are showing that the social determinants of health are also the social determinants of mortality in childhood. And we've known for a long time that infants born into the coldest households this winter into the most deprived households this winter are twice as likely to die in infancy by the age of 2, to be snatched from their mother's arms, than those in the richest decile of postcodes. And for what? For the situation into which they have been born, and the housing in which they live is a key component of that. So there are the acute problems, there are the chronic, long-term, lifelong, stark, grave consequences that we've already discussed, damaging those lungs, damaging those airways in that golden window of opportunity where we should be promoting good lung health, not putting children in situations that get in the way, will have lifelong consequences. And Alice and myself and other paediatricians, and certainly Sir Michael and his team, believe that the lifelong battle against inequalities can in many ways be won or lost in childhood. So that's another reason children are important here. And even if we think beyond physical health, as Sir Michael alluded to earlier, the mental health impacts of this are hugely important, and the impact on sleep is hugely important. But also, and we saw this, didn't we? We saw this through the pandemic, that children may not have been the face of the pandemic, but they were affected in many, many ways. And it seems so cruel after 2 years of children not having the childhood that they deserve, that we're going to enter a winter where parents will be spending money on the absolute essentials of life, and many of the things that we'll give are things that have been highlighted in previous reports. After the last recession, UNICEF published a report about poverty in children in rich countries, and the way that it manifests is that they lose out on birthday parties, on Christmas presents, on toys, on new clothes, on educational opportunities, even on stationery. You know, as those of you who have children will have done the same as me and my wife this week, which is thought, oh my God, back to school. For many families, that's an absolute nightmare situation, and they're going to have to choose between heating the house, buying the food, and buying the stationery and the PE kit and the very tools that their children need to get out of poverty. So the impacts on children are immediate and long-term, lifelong. The impacts of children are health and opportunities. It's hugely important that we think about this, and we're very grateful to the team for allowing us to bring that paediatric element in here. Before I hand over to Alice, I would just like to tell you one other question that I reflected on this morning. I was asked by a few interviewers what one word I would use to describe this. They said, you know, it's grim, it's stark, it's bleak. What word would you use? And I said, unsurprising. Anybody who's surprised that we're falling into this cost of living crisis or into this fuel poverty crisis hasn't been paying attention to the work of Sir Michael and his team and others around the country for decades, showing us that the social determinants of health are so important. everything that we do here in this hospital, this amazing hospital where I am, Alderhay, everything we do here is about keeping children well. And as Sir Michael has put it, many times, we're then sending them home to the very situations that make them unwell in the first place. When we're in a country where 1 in 3 children at least lives below the relative poverty line, and 1 in 2 children or thereabouts is living below the minimum income standard line, it is not at all a surprise that whatever the reason might be, the war in Ukraine, inflation, the pandemic, whatever it is, families do not have the financial resilience to get through these situations. And so that's why we hope this report will go some way to highlighting those structural problems, both with homes and with the society in which we live. Thank you, Tammy.
Thanks, Ian. And Ian's been a fantastic advocate, and hopefully we'll be hearing more from Ian over the next few years. He's right, in terms of evidence on housing, we know in the 2010 report we could have said more about housing, and we certainly rectified that in our 2020 report. But also I think what happened as a result of the 2010 report that we did on health inequalities is researchers and people working on health inequalities and the social determinants realized we needed better evidence, and we certainly have better evidence now in 2022 than we did in 2010. And we know that housing is affecting health in the short and the long term. It's affecting physical health and mental health. But it's not just a voice of doom that we have here. There are things that can be done. I know a lot of people have put some of the projects that they're doing in the chat. A lot of the voluntary sector are here, and that's fantastic to see. Certainly, that's one of the issues or factors that we've been advocating for months in the work that we've done in Cheshire and Merseyside, in Greater Manchester, in Lancashire and Cumbria, and Luton and Waltham Forest and other areas we're working in, is getting the NHS to work more proactively with the voluntary sector and commission in the not just over 6 months and in the short term, but to really have a good working relationship with the voluntary sector. But we also have hospitals doing that now. And I'd like to bring in Alice Lee now, who's a registrar who works with respiratory pediatrician who works with Ian at Alderhay Children's Hospital. And Alice has been working with Alderhay on a partnership that they have with Liverpool Children's Centres. Alice, can you turn your camera on? Is that okay? And Ian, if I could ask you to turn yours off for a moment, because I'm trying. Oh, Ian, I'm happy for you to leave yours on as well. Welcome, Alice. So if you could just tell us a little bit about this partnership that you have.
Yeah, so the partnership was driven both by Ian and one of the fantastic coordinators at Liverpool Children's Centres, Debbie McAndrew, who's unfortunately couldn't make it today. And it was funded by an NHSE programme. And initially it was set up in response to the expectation that we were going to see a surge of a viral infection called bronchiolitis after the COVID restrictions were all released. Now, bronchiolitis is a viral infection that affects children mostly under the age of 2. And we know that levels of severe bronchiolitis and especially hospitalisation are associated with levels of higher deprivation and poverty. And actually the map of bronchiolitis admission rates for hospital looks incredibly similar to the fuel poverty map that we showed earlier with Jess's slides. So the programme hired 10 really fantastic women who were parents who had already experienced going through the children's centres with their own children, who were representative of their communities, to be trained in respiratory pediatrics, in knowledge on bronchiolitis, what it is, how to recognise it, and how and when to seek healthcare. But also going back to that recognition that we really need to be focusing on the wider determinants of health. So not only were they talking about bronchiolitis, they are supporting families with accessing programmes like Citizens Advice and signposting to places like shelter for housing issues as well.
And you know, what has been the response from parents? I mean, in some ways you could say they should have had access to this, they should have known about it. What have parents said to you about this partnership?
Well, it's been great. So far they've reached, so it started in December and they've reached almost 3,000 families already within the first 8 months or so, which is great. It's really good outreach and much better than, Ian or I as doctors could have managed. And we've been really lucky to have some researchers from Edge Hill as well assessing the impact in the community. And the feedback from the parents is that they really appreciate the support. Parent champions make them feel a lot more confident in managing their unwell children. And also the recognition that actually it's really difficult to work out what help is available and who to ask. So for a children's centre to be a single point of access with a trained professional as a parent champion there to be able to plug them into all those services that they really need is really fantastic.
That's really useful. And I think that kind of support, that social welfare legal advice that organisations like Health Justice Partnerships and Citizens Advice provide is being recognised more and more by the NHS and local authorities as really something that needs to happen because the benefits system has been made so complex. And, you know, Alice, to sort of, you know, if other people here are listening to this and thinking, well, how do I get in touch with my local children's hospital or local hospital? Has it been easy to set up this partnership, or what could you recommend to other areas?
It has been, well, Ian can help me out here as well. For me, it's been a dream to work with the children's centres in Liverpool. We've found them really, really accommodating, really enthusiastic and supportive of the programme. Like I said, it would be great to have Debbie on the line as well to discuss her experience of working with a tertiary hospital as well. But I think it's been a really good collaboration, and it's definitely something that we need to be continuing to do.
But how do you start it? Somebody's just pointed out in the chat about, you know, I'm in Bristol. How do we, you know, this sounds good. Where would you even start to make those connections? Because it's making the connections between the social determinants, isn't it? It's seeing this is the problem further down the line, as Ian pointed out, but how do we prevent it from happening in the first place? Where did you start off?
So we started off with reaching out to the children's centres, because what we've learned, you know, as doctors, I think sometimes we sit in our tertiary hospital and we don't realise what organisations are out there in the community. So having people in the children's centre saying, actually, there's already an organisation that is available for this, and shelter run down the road. They've been a really great point to then link into that wider network of people who are already doing fantastic work in the community. And, you know, we've really benefited from that mostly.
Ian, did you want to add anything?
I think from the other one, if people are trying to get around.
Sorry, Alice, there's a bit of a delay there. I thought you were finished. Keep going.
That's okay. I was going to say about how people would access their local hospitals to work in these partnerships, but I'll let Ian answer that.
Alice has done an absolutely cracking job. You know, it's not fallen out of the sky. Both her and Debbie have worked really, really hard. For me, one of the other key things about this was, again, you know, looking back through public health data. This is about how do you make public health data make a change, right? In people's lives. And what have we been failing at doing from the NHS? We've been failing to get mothers in the poorest parts of the country to breastfeed. We've been failing to reduce antenatal smoking rates. We've been failing to help children in poor quality housing. We've been failing on all these things. And part of the reason for that is that we just don't get it. I'm not a mother in a council estate in Liverpool or Bradford or Middlesbrough. For us, very much this is about empowering the community. The mums who Alice has been working with, and it's been beautiful to watch. If there was a film about this, it would just be the most beautiful film. Watching these mothers grow and develop in confidence and skill. And what they have is a credibility amongst other mothers in the same situation that they're in that I will never have, and most doctors will never have. And, you know, people making the decisions, people telling parents what to do are usually the people furthest away from the situation. So they get it, they have a credibility, they go into these homes with an older hate badge, which means something. It means that they're not just, you know, sticking their nose in, but it's something very real, and that human element of this I think is crucial. They can empathize and sympathize in a way that is meaningful to families, and, you know, at a very basic level, they can communicate with families in languages that we don't know, you know, in parts where English isn't necessarily the first language for lots of families. So I think that's been a really important thing. Empowering the mothers to deliver this is a new thing. Alice, did you want to mention about how we're moving forward with the food bank and the clean air clinic as well?
Yeah, of course. If we have time with that, Tammy.
I'd love you to talk about next steps, definitely.
I was just going to say, following on from Ian's point as well, and something that's just come up in the chat, is that the most important part of this has been co-developing the programme with the parent champions as well, because as Ian said, they're in the community, they know the issues, and they've been the driving force of what training we've arranged for them and which links we've arranged for them as well, which has been fantastic. So what we're hoping to do as well, so Professor Sinha set up the clean air clinic in Liverpool a year or so ago, specifically because the respiratory clinics were seeing so many children whose primary issue was the air they're breathing, both indoor and outdoor air quality, which is obviously just going to continue to worsen, unfortunately, with the cold homes that we're seeing over this winter. And what we're trying to do is now linking in the parent champions to that programme, so that rather than children having to go through hospital admissions and, you know, unnecessary referrals, if we can get a point of access where children can be seen straight away through this clinic, would be absolutely fantastic. And similarly, recognising who else is in the community, children's centres are, you know, a vital service in the community, but also food banks as well. And we know that we're seeing more and more people using food banks. So trying to station these health services within those places is going to be our next step.
Great. Thanks, Alice and Ian. And to read more about that, it's in our report. And also, I think it's a great example for others who are on the call working in different areas in the UK to say to an ICS in England and other equivalents in Wales, Scotland and Northern Ireland to say, this is the NHS's responsibility. The NHS has a role in prevention in terms of housing. I know in the work that we've done, we sometimes have pushback about how the NHS doesn't have a role in housing. And here you go back to your ICS, go back to your ICB, go back to your organizations locally and say the NHS does have a role here. I just want to move on to some of the queries that we've had. Maybe Jess, Ian did touch a little bit on mental health. Jess, do you want to say a little bit more about, people have talked quite a bit about the impact on mental health of cold homes on mental health?
Just to reiterate how serious it is, and I think it does get overlooked. So mental health, the impacts of cold homes on mental health work in a number of ways. I outlined some of those around loneliness, the stress of the house all being in one room together, including teenagers all locked in one room, the only room that's heated, causes enormous family conflict, additional stress, worry, having to pay your bills. So there are some fairly robust evidence around the impacts on mental health of those. The misery of living in a cold home, you know, leads to much greater depression and anxiety. And I think also, you know, if you're in poor health as a result of living in a cold home, that affects mental health. We know physical and mental health is so interrelated, it's hard to distinguish between the impacts here. But certainly I think we're going, you know, I highlighted the mortality data because it's the clearest, you know, you can actually measure, and it's the most, you know, shocking statistics. But the health impacts, the physical and mental health impacts from a huge range of ways in which cold homes affect people's lives are absolutely enormous. I mean, if you think, you know, additional mental health impacts, where you paying most of your income into fuel, nothing left for the kids, as Ian was pointing out, nothing for school, stuff for school, food is constricted. So, you know, you can see, even though we don't have the absolute data to hand, the impacts on mental health are absolutely catastrophic. And again, we're going to see a mental health epidemic as a result of this. And coming on the back of the pandemic as well, this is going to be really, really serious this winter.
Ian.
Yeah, okay.
Ian, you don't have to put your hand up, you can just talk.
No, I don't. So I just wanted to add, I think Jess summed it up absolutely perfectly there. One of the other things that we're very much hearing from children and young people in you know, less lucky situations, certainly than I'm in, is the stigma the stigma of poverty, the stigma of the manifestations of poverty. And, you know, we've been doing some work about, for example, universal free school meals. Just take away that stigma, take away the need to have to go and ask people for help. Just help people, and then it's done. And that needs to happen at structural level. But the stigma, I think, in the children that we see, you know, you can smell it on their clothes. You smell the mold. They can't dry their clothes in the right place. The children pick up on this stuff, and they're, you know, that children in general, it's a very altruistic time of life, but it's also a time, you know, particularly in adolescence, of real self-consciousness and introspection. But yeah, that's all I wanted to add.
Okay.
Excellent.
I'm going to come to the warming spaces after this question, but I would like to come to Thomas Hennell now, who asked there's been a few questions in the chat about ethnicities and ethnic minority households and why that's higher. And Tom Hennell from the OHID office in the Northwest is a bit of an expert in this, and he'd put in the chat, and I just wanted to come to Tom to say, can you just explain a little bit about the answer that you gave? Because I think people would be interested to hear a little bit more about that. And rather than me reinterpret your words, Tom, can you just explain? You're from OHID.
This is on. Can people see me? Yeah, right. This is some ongoing work that we're doing for directors of public health in the Northwest. So it's not published as yet. But we are discussing with directors of public health how we publish it. What we've done is to look at the individual response data set provided on the English Household Survey, which can be downloaded from the UK Data Archive. I don't know whether anyone's done that, but that gives fuel poverty by household in 2019. And we've updated those households with what's happened since 2018-19, in particular with the recent price cap increases and with all the various announced reliefs. And one of the things that came out of that is just how much more severe fuel poverty is, both within the Northwest and nationally, in households with children, but especially households with teenage children, because the household survey uses a modelled demand for fuel use, so teenage children require rooms of their own. And this impacts with ethnicity, because ethnic minority households are more likely to have children and less likely to be pensioners, whereas the reliefs that have been announced so far have benefited pensioners more than they have benefited households with children. Effectively, the reliefs are one set of relief per household. If you've got a household with 6 people in it, you get the same amount as a household with 1 person in it. And this it appears to have, in terms of the modelling we've done of ethnic minority households in the Northwest, in that set, this differentially skews the value of the reliefs away from ethnic minority households. I mean, I can flash up some graphs, but I don't want to take over the discussion.
I know we're connecting. We're working with Tom and I work in Cheshire and Merseyside, so we'll make sure that it somehow gets shared wider. But I think it's an important. There's analysis that is being done. Just to go back to the point that quite a few people have raised about warming places, and I was also reading some. I think Tara, who's one of the directors of public health in Cheshire and Merseyside, and also I was reading some plans from Lancashire this morning about having places like libraries as warming places for people. And I think in terms of equity, there's definitely some issues there. I'm thinking of people with disabilities and the ease with which to get to a place like a library. And, you know, there's some difficulties there, but for everyone, you know, in terms of the cost of living and, you know, are they going to pay to go to places? How hospitable will these places be? Are you just going to sit there all day? How comfortable is that, just to sit in a chair in a library? And how realistic is that? But also I think for people with disabilities or elderly people, that level of comfort, or children, do we want all of these people? Libraries are supposed to be quieter community places, would this really be appropriate? So I admire the effort of many councils, and this is certainly something that's come across from North America, where they have cooling centres as well as in Australia. But Ian, Alice, or Jessica, do you have any thoughts on what these warming places will do, or what councils can do over these next few months?
So there are emergency things that can be put in place, and warm banks, warm places is definitely, they're going to be needed this winter, there's no question. This is a humanitarian crisis, and this is the tragedy that we're now talking about, the emergency measures in the 5th richest country in the world which need to be put in place, and they desperately need to be put in place. Yesterday we were slightly sidetracked in our press conference when a couple of the reporters asked about how to keep newborn babies warm and how many blankets was it safe for them to have. I mean, this is the level at which people are thinking that this is a solution to the crisis, and it's not. The solutions lie in the quality of housing, in raising people's income and managing gas prices. And we really, really need to focus on those 3 elements and manage those. And there are things that are going to have to be in place this winter in communities to stop this health crisis getting any worse than we already anticipate. But in terms of solutions, I think we really need to keep our focus on those 3 elements.
Sorry to jump in, Tammy. I totally agree with Jess there. And again, you know, the default is, well, what can people do around it? Put the baby in a warm house. That's the issue. Warm places are going to be the new food banks, aren't they? They're going to provide a less good thing. They're going to be. I mean, we've spoken to. I think it's great that people are offering this. You're right. People need this, and there are other benefits of being in a social place. You know, don't get me wrong, but we were talking to a team on the southeast coast who have a hospital and lots of GP practices elsewhere. And I said, have you thought about kind of putting paediatric clinics in the GP practices? And they said to me, we thought this would save families 2 hours of travelling, loads of train costs, this, that and the other. And they didn't like it because on that day, they would have to choose between going to a GP appointment or going to a food bank. Right? This is the level of desperation in which people find themselves. And you know, one of the reasons for this, for example, and I've been thinking a lot about the interventions that we might say, the things that we might do. We know that a huge proportion, a very large proportion, much larger than in Norway and Scandinavian countries, of people in the lowest socioeconomic quintile are in the gig economy. They're in the gig economy for work. And that brings with it, you know, the need to work. Otherwise, you don't get paid. And so the very people that we want to be accessing warm homes or whatever are the very people that will lose money. They will lose out in doing so. So I completely agree with Jess. We've just got to keep bringing this back to the structural change which is needed. If we looked after people's homes, looked after people's income, looked after people's rights, we wouldn't need warm places. We wouldn't need food banks. I agree with you, Jess. I totally do.
I think, you know, this is what people are talking about. We need some short-term, we definitely need short-term solutions, but in the longer term, somebody mentioned in the chat about climate change and about, you know, this is our report refers to this, and all of our reports have talked about the connectivity between climate change and health, and addressing climate change and addressing the health inequalities. And that has, addressing climate change as well as reducing racism have become 2 of the additional points that we have in our originally Marmot 6 themes, but now is 8 Marmot themes. And one of the slides, Jess, if you want to talk about this in terms of insulation, you know, the rates of insulation have absolutely plummeted, and those are policy choices that have been made. And I know, you know, in the work that we do in local areas across England, that housing departments in local governments are struggling because there are no budgets for insulation. So they're trying to find it where they can. And this needs to change. It can't just all focus on these short-term warming centres. We need system structural change. Jess, do you want to say anything about climate change and fuel poverty?
Well, no, except to say that they go hand in hand. Home insulation done properly is good for both. It's a win-win. It's good for equity. It's good for reducing poverty. We've been talking about this for years, and hopefully this current focus on these issues will bring that to light. But definitely it's one of the areas where there's a very, very close association, positive association, win-wins, educational achievement, reducing poverty, keeping people healthy and warm, and climate change.
Right, we're almost at 2 o'clock. We've had an amazing discussion, and we will be sharing the slides, although I must admit by far the most of the slides are in our report. So please do go to our report, share it with everyone. Most of this, those slides are from the report, from our previous reports, or from some news websites, but we're happy to share those slides with people. I'll start with Alice, and then I'll move to Ian and Jess. If we just wanted to have 1 or 2 last words from all of you at the end of this hour. Alice, I'll come to you first.
Thank you. I was just going to say it's really great to see the chat as well, to hear all the local drives of everyone who's trying to, protect their local communities this coming winter against fuel poverty. And I think if everyone can just gather around and make that a national drive, that would be fantastic.
Great. Thanks. Alice, Ian?
I just want to thank both you, Tammy and Jess, and Sir Michael and your team for everything that you've done here. Thank you for including us. Again, as with all these things, when you start putting out messaging like this, we're going to face a backlash of we're just scaremongering, and this is way beyond that. This is Dickensian. The idea that over half the country will be in cold homes and that will make babies sick is not acceptable. So thank you for everything that you're doing to push this, and I hope to the people on the call that you find the report useful, and do keep in touch. Our details will be in there, and certainly our end, Alice and I would be delighted, more than delighted to help. And yes, keep an eye out for Alice's name, because she's up and coming in this sphere, and you'll see her name a lot over the next few years.
Thanks, Ian and Alice. And Jessica?
Just to thank everybody. I've been keeping half an eye on the chat. There were some fantastic comments. We'll consolidate those, we'll respond to them. And I think, for the people working locally who are making a difference to the people's lives who are living in poverty at the moment, and increasing numbers, doing a fantastic job in the most difficult of circumstances. Absolutely great to hear from you and to make that visible. We will do what we can. Please stay in touch. We'll push as much as we can on the big structural factors and the national policy agenda, working with local governments. But we need this across the whole spectrum, from the micro-local right through to the big policy. So it's great to have that represented today, and thank you.
Great. Thanks, Jessica. And I agree. I'm going to echo that there is clearly a huge amount of work being done locally, and we salute all of you and support all of you in the work that you're doing. And we are using words like a humanitarian crisis. We are using words like the Dickensian. This is an absolute national crisis and is completely avoidable, as Michael has said, and as our report points out. Do stay in touch. We're at the Institute of Health Equity. Our report is there. We have previous reports on this. Look at our other reports. If we can be of help to you, if you want to share case studies with us about what's working, what's not working, it's always good to know both of those things. Do stay in touch. And remember, there are examples of the NHS working actively with partners to address cold housing and fuel poverty. Please use this as an example to talk locally with your own partners. And enjoy your afternoon. Stay in touch. Thanks so much for joining us this afternoon. Take care all.